So the challenges we have when we are accessing medical care, first of it is the communication between the patient and as a deaf patient and the doctor. You know the science words that you're supposed to communicate with a deaf person, it's always hard. You try, even this sharing of the writing with the doctor, it's always not enough. As a deaf person, I feel like maybe the doctor is not understanding how I'm feeling. So at the end of the day, I might be diagnosed with a wrong disease. So I feel that communication gap is the one that we're supposed to resolve.
The challenge I've faced from the few I've seen, mostly the way to express myself and also to understand what they express, especially the movements of the arms, the facial expression, because you will wish to understand what the arm movement means, but sometimes it is hard. But from the number I've gotten exposed to, I've also learned from interaction a few sign languages. Sometimes if you are lucky enough, the ones who know how to write, you get a piece of paper and you write down and your conversation goes through writing. And most times that's the method I use, and it has helped somehow.
Interpreters are very far from deaf people. And also lockdown has seen the interpreters staying back home. So many hospitals, doctors and nurses don't know sign language. So communication is difficult. So deaf people have been getting coronavirus. Many of them have failed to go to hospital because there is no communication.
Many times we communicated through writing. You write and you give to the person. But now some deaf people don't know how to write, I'm afraid. Parliament has approved the law that says hospitals should appoint or employ sign language interpreters who will in turn help with the communication between the deaf community and the health workers. But this has not been implemented. We are continuing to advocate for the employment of sign language interpreters in health sectors.
You should encourage all professionals in whichever field they are to at least have that component of the sign language, that at least every entity, every organization to have at least that component. I think every health facility, their management will encourage them to have at least focal persons or encourage their staff at least to have that component. How? It is simple actually if people are willing to have short courses for general awareness and general learning on sign language.